We're here at a Global Health Conference at Loma Linda University 2018, and I have with me President of Adventist Health International, Dr. Dick Hart. Thank you for joining us.
Thank you, Tiffany. Good to see you.
Good to see you. Tell me, if you will, a little bit about Adventist Health International.
AHI, Adventist Health International, began just about 20 years ago now. It was basically arose out of a discussion on the board here at Loma Linda University when we had a strategic plan that said Loma Linda would help the global health work of the Adventist Church. And one of the board members said, "Really? How?" And that started a discussion that went on for some time, and I was asked then as a younger faculty member, to help guide and come up with a strategy of what could Loma Linda really do to help the health work of the church. Many of our mission hospitals were struggling. We have 175 hospitals in this church. Half of those are in the U.S. The other half are scattered primarily in developing countries. We have 25 in Africa, 14 in Inter-America, 11 in the Philippines, 11 in India. And so out of that discussion came the idea of creating an organization that would be linked to Loma Linda and the other health systems, but that was specifically focused on trying to help get our mission hospitals back on their feet again.
That's wonderful. And over the past 20 years, your budget has grown and the number of hospitals you're helping has grown to what now?
We started off with 2 hospitals that the church asked us to work with, Davis Memorial Hospital in the country of Guyana and Gimbi Hospital in Ethiopia. Both of them were about ready to die. And so we started off with those 2. We've gradually grown through the years. We now have something over 40 hospitals that we work with around the world.
That's wonderful. Let's talk for a minute about Africa. You said there's how many Adventist hospitals?
25 in Africa.
And how many are part of AHI?
Well, most of them are in one way or another. We are not as actively involved with a few of them, but most of them, probably 19, I think is the latest count, are actively involved with us.
And what are some of the projects that are?
There's a variety of things. Hospitals in Africa are struggling for whatever historical reasons. It's very fascinating. The missionaries that went to Africa started hospitals in the rural areas, what we call bush hospitals or end-of-the-road hospitals. So many of those hospitals are sitting right at the edge of the cash economy, where most of the patients that come to them don't have the ability to pay very much. So that has meant through the years of maintaining those hospitals, keeping their equipment up to date, keeping their buildings up to date, keeping adequate staffing there and so on has been very difficult. It also means, unfortunately, that many of our African professionals don't want to take their families out and live in those rural areas. They want to be in the cities where there's school, there's amenities, there's various things they can have there. So staffing and maintaining those hospitals has always been a challenge. And that's what we've made a major commitment to, upgrading equipment, building hospitals in some cases, new buildings, remodeling, finding staff. We've revitalized the Deferred Mission Appointee Program from Loma Linda, so graduates from Loma Linda in dentistry, medicine, and now all the professions can go work at those hospitals, and we will pay their educational debts for them while they're out there working. So there's many different things we've had to do to try to make this thing work, but it's gradually bringing them back.
Absolutely. And I think right now the focus has been on at least 5 or 6 countries. You have Botswana, Liberia, Chad, Malawi, Zambia. Tell us about some of the big projects that are going on there.
Well, probably the biggest one is in Malawi, what we call Malamulo Hospital, the granddaddy of Adventist mission hospitals, frankly. The hospital started in 1915, so just shortly after Loma Linda began. It's a 200-bed hospital now with residency programs. We have residents from here rotate out there. We've started a surgery residency program out there for African graduates of medicine. But there's a lot more to it than that. I mean, it's labs, it's x-rays, it's pharmacies, it's procedures, it's equipment, it's scopes, it's all the sort of stuff that goes into trying to make a modern hospital. Because of our linkage to Loma Linda, we naturally think a lot of education. So it's a matter of making these not just hospitals, but teaching hospitals, where they can have either, if they have a nursing school, or in Malamulo's case, they have several different schools and residency programs. You're strengthening the teaching programs as well as the hospital itself.
Great. And so AHI is actively involved in all of those projects, sort of stretched thin, if you will. Are there any other big projects going on the continent of Africa?
Well, there are quite a few. We, of course, just weathered the Ebola crisis in West Africa. We had 2 hospitals in the middle of that, Cooper Hospital in Monrovia, Liberia, and Waterloo Hospital in just out of Freetown, Sierra Leone. Both of them were in the heart of Ebola country. Our hospital in Waterloo Hospital in Sierra Leone, the government took over and used as an Ebola center while the crisis was going on, and then have given it back to us. So we're now in the process of bringing it back online. Cooper Hospital was right in the middle of Ebola, and with our staff there, led by Dr. Gillian Seaton, a surgeon, we decided to make our Cooper Hospital into a non-Ebola hospital. And the reason for that is there were a number of Ebola treatment centers coming up, but most of the hospitals in the town shut down.
Yeah.
It's a city of over 1 million people, shut down because hospital workers were afraid to come to work.
Sure.
They were afraid to be exposed to the virus. So people were dying on the doorsteps of hospitals from appendicitis or from trauma or from something else because there's no place to get care. So we took our little 25-bed hospital and made it as really the only functioning non-Ebola hospital to take care of all the emergency needs in the city of Monrovia. And Dr. Seaton stuck it out through that. The staff stuck it out. They got infectious cases got into the hospital twice. We had to shut down the hospital for the incubation period of 21 days, evacuate everybody, put them in quarantine. And then they came back again and went at it again, happened again. We had to go through it again. So brave people, but did a great service during that Ebola outbreak.
Well, that's a fantastic story. And other countries?
Well, there's a lot going on in different places. Zambia's got several hospitals there we're trying to work on. One of the goals we have, because all of our hospitals are bush hospitals, we're trying to now develop more facilities in the cities because that's where a lot of the local professional staff are. And you've worked in one of those in Blantyre, Malawi. We'd like to do that in quite a few cities where we can develop facilities there where people can live in the city but still be identified with Adventist healthcare work where they're employed. So that's a major goal of ours over the next few years, while not giving up on the rural hospitals, keeping them going as well, but making a partnership with city clinics.
So you have Lusaka and Lilongwe coming up for those
Lusaka
two.
and Lilongwe. We're looking at another clinic, Limbi, and out on the other side of Blantyre. We're talking about Ibadan in Nigeria. We've talked about that for some time, but there's a number of places that could work if we could get all the resources in place.
And it sounds like a tremendous amount of work to support a rural hospital and a city hospital. The rural areas have poor people that need to be reached, but very little resources. In the cities, you have people who are accustomed to getting a higher level of care, and most of those things aren't available in country. How do you help these hospitals figure out how to provide high-level care to paying customers and cheaper but still quality care to the rural areas?
I wish you could have been with me a couple hours ago. We have met with our people from Chad that are here at the Global Healthcare Conference. So Chad is one of the poorest countries in Africa, but about 2.5 years ago now, James Appel went out to one of the most rural areas in eastern Chad, up against the Sudan border, and started a new hospital with nothing. We built a few buildings, we put some stuff together, and started providing clinical services. They've been swamped from day one, but most amazing is they are operationally solvent already. They're paying all their bills, they're paying their staff, they got 2 local doctors hired there, and so they are making it already from the patient fees of people that come in. So even in rural areas, if it's planned well, that can happen. Cities, you have to have a higher level of sophistication and a little bit more equipment, but then you also have a stronger economy base that you can support that.
Those are wonderful stories. If you could just, as we close, think of one story in particular or one sort of image that you have in your mind about the continent of Africa and the help that AHI has been able to provide in the last 20 years.
Well, there's many stories I could tell. I mean, I'm an old public health doc, so I particularly am thrilled with some of the rural stuff, because while we talk about the cities, and I'm very committed to that, most of Africa still lives in the bush, still lives in the rural areas. In Malawi, we have a clinic system, as you know, of 17 clinics scattered all across that country in rural areas, where you have a nurse or a medical assistant providing first line of care in those rural clinics. And one of our goals right now we're working on is upgrading all those clinics so they have a good functioning laboratory, so they can do good tests where they're at, eventually getting an ultrasound for each one, training the people to use them, so that we're actually taking healthcare in the rural areas up to a higher level as well.
Thank you very much. It's amazing the work that's going on, and some institutions here, like Adventist Health International, supporting our doctors and our Adventist institutions overseas, over 25 hospitals in Africa getting assistance at one level or another, and many of these institutions weathering the Ebola crisis or becoming an intensive care unit in a poor country. And we're very grateful for the work that's done, and we hope people will continue to support Adventist Health International with its projects.
Thank you. Thank you.